Okay, hello everyone. I wanted to show you how a concept map could be developed in action. This activity will help you develop that compassion and empathy by understanding that everyone got their own life stories and beliefs and values that uniquely structure the way they experience the illness that they have, which perhaps already become their part of their life. So we got Jenny. She's 22 years old, female. She was diagnosed with relapsed Hodgkin's lymphoma with metastases. She has very supportive parents. Because of her cancer and treatment, she had to defer her uni. The cancer is causing her pain, which hasn't really been controlled well. She's having chemo for her cancer, and she has already missed a few sessions, and you as a nurse becoming a bit worried about her because you know how important it is for her to have a complete treatment to have a better survivor chances. She's requiring central line to have the chemotherapy, and chemotherapy is causing her being nauseous, and her hairs hasn't fallen off as a side effect. So that's as a nurse, that's the information that you have on the surface. So you're thinking, okay, her pain hasn't really been controlled. She has missed a few sessions. What's going on? What can we do? Let's see what we can do. This is a beginning of developing a concept map and see what. Okay. So you walk off to Jenny and ask her, starting the conversation, Jenny, is there anything you enjoy doing? And Jenny says, I actually like makeup and fashion. I like putting makeup and looking up different pictures of magazines, and I like to sketch. I in fact want to work in fashion in the future. But since I have chemotherapy making me nauseous and I lost a lot of weight and my hair's all fallen off and I don't want to look at the mirror anymore, so I don't enjoy doing makeup and fashion anymore. I lost a lot of weight. I feel different, and it makes me self-conscious. Why, you ask? And Jenny says, because I look different. And I feel not normal. What I want is feeling normal again. I used to have many friends, but then they didn't know how to be around me. They were awkward and didn't know what to say. So they became distant, and I feel alone and isolated. My parents are great. They're very supportive, but they're very overprotective. And I want to be independent. I used to do things on my own. It makes me feel like a child again, and I hate it. It makes me feel depressed. And you ask, but then how come you didn't turn up to the chemotherapy session? Isn't it a bit childish thing to do? And she goes, but sometimes I feel like that's the only way to restore my independence, because I feel like that's the only thing I can do at this stage. What can I do? There's nothing that's within my control. I used to work in a restaurant and I had to quit. It used to bring me lots of experiences. I met different people. It was great. But since I quit my job, I feel stagnant. I deferred my uni and I feel stagnant as well, because I see all my friends doing all different things, going to school, travel, or getting a job, or being trained for something, I feel stagnant and I feel somehow worthless sometimes and feeling behind, and it makes me feel bitter, and it all makes me feel quite depressed. And sometimes I just want to avoid everything, so I just don't turn up to the appointment. How's your pain going? You ask, and she goes, it's always there. It makes me not being able to do things, and it makes me more isolated because I can't exercise, I can't meet people. The pain's always there. Then why don't you take medication for pain? And she goes, because people would look at me weird. I'm not a bad person, and I fear that I'll be addicted because it's same thing. It's morphine, isn't it? So you can see how her life story unfolds a lot more. There are a lot more, you know a lot more about her now than before. So that's the only surface. On the surface, that's the information you have, and you can see that there are so many different elements that's complexly interwoven and makes a unique experience. This is just the beginning of the concept map development, and it will become a lot more complex than this. Oh, it's shaking. So in terms of the assignment, it requires you to make concept map that has more than 4 layers. And what it means by that is this is 1 layer, 2nd, 3rd, and 4th. So that's what it refers to. So the map that we had before, this only has maybe 1, 2, 3 layers, so it's very one-dimensional. And as things unfold, you have so many different layers of sub-concept. The minimum is 4, and you'll see that there will be many interlinks and relationships. And for her, you can see that because she's young and having a life-threatening illness, it's impacting her in a unique way. So her context is making her experience somehow different to people with older, people who's a lot older and have cancer. So that's something that we can take into account when we provide care. So in terms of providing care, so her pain is not controlled very well. She has missed a few sessions and she's feeling quite depressed. But by understanding why she's not compliant and why her pain has not been controlled and why she's feeling depressed, we can provide better care that's catered to her. Start developing concept map and show it to your tutors for feedback. I think that would help. Good luck, everyone.